If you have struggled with any type of skin conditions, especially eczema, psoriasis, or some type of autoimmune that is related to skin health, and you're not able to get rid of it, including adult onset acne, I highly recommend watching this full interview. Hey guys, my name is Judy Cho, and I'm board certified in holistic nutrition. And I have a private functional medicine practice where we have worked with over 2,000 carnivore patients get closer to root cause healing. Today, I have the pleasure of sitting down with Dr. Keira Barr. We talk about all things skin health. In our private practice, we have a subset of carnivore patients that, even as they heal their gut, even as they eat strict carnivore, meaning no plants at all, they will find a lot of healing, but there is a subset that maybe 5% of their psoriasis or their eczema is not completely gone. And in this conversation, Dr. Barr talks about what can be other reasons or levers to pull to get to more healing. As you'll learn in this conversation, there are many factors for skin health to be impacted. I love that Dr. Barr takes a very practical approach in thinking about, is it your skin? Is it your diet? Is it your sleep? Is it the clothes you're wearing, the products you're using? We talk about all of these things and what more you can do to get to healing. Again, if you are suffering with skin health, this is a conversation that you'll want to listen to. Let's get right into the interview. Hi, Dr. Barr. I'm very excited to have you on. As I was telling you offline, I haven't had a person that specifically spoke about the skin when it's our largest organ. So I'm really excited for everybody that's listening and watching to get to know you better. If you can introduce yourself.
Yeah, well, I'm Keira Barr. My background is trained in dermatology, dermatopathology, but because of my own lived experience with a lot of different health issues that really kicked off with my own bout with a scare with skin cancer, it really led me down the path of integrative, functional, and ultimately mind-body medicine, which is where all the dots really started to connect and really led me to where I am now, which is, the creator of the Center for Mind Skin Medicine and really focusing on a mind-body approach to skin health.
I think by now, most of us know there's like a gut brain connection, but there's also like a skin connection to all of that. If you can just talk through that a little bit for us.
First of all, I think in conventional medicine, as a subspecialist, we're like, yeah, there's the gut, like gastroenterology, dermatology, cardiology, but we are all just one being and everything is interconnected. And I think, I'm biased, but I think the skin is like the most amazing organ because as our largest and most visible organ, it can give us so many clues about what's happening beneath the surface. And there is a very significant gut brain skin connection, but it really kind of goes back even one step further, which is really the field of psycho-neuro-immunoendocrinology, which is a really big, confusing name. And we can really simplify it by talking about the NICE network, which is our nervous system, our immune system, our cutaneous or skin system, and our endocrine system, which are talking to each other all the time. Bidirectional communication. So where does the gut come into all of this? If you think about the nervous system as command central, it is always scanning our environment for cues of threat and danger. And depending on the cues that it picks up, it is going to send signals to your immune system. And your skin actually has its very own stress response system. So these signals are going to be floating throughout the body. When we are under a perceived state of threat or an actual state of threat, I feel like I'm speaking to the choir because you know this, but our body is going to prioritize the functions that are necessary for survival. Eating, digesting, not one of those functions. So our gut motility is going to slow down. Digestive enzymes are going to decrease, which can create imbalances in the gut bacteria. And some of those may produce something like LPS, lipopolysaccharide, poke holes in the gut. Inflammation can seep out, and the skin becomes a target for that. So that gut-brain skin connection, that's one way. But the skin itself, as I mentioned, not only is it part of this nice network where there's bidirectional communication, but our skin is also a stress response organ. It has its very own HPA axis. So it is creating the same hormones, stress hormones, and can produce like inflammatory signaling. And so that also can create just be a reflection of what's happening both from the outside in and the inside out. So it's a really interesting, like the skin when we're having sensitivities or what have you, the skin will reflect when the gut is kind of out of balance.
Yeah, we'll hear that, the skin is a reflection of what's going internally, but it also sounds like the skin also can communicate with the internal to say that there's also issues too. Can you give us an example of how like all of that works? So we'll hear, oh, I'm having stress, so now I have a pimple, but how does that really work together? Like how does stress create this response and then we have triggers that will manifest in our skin? Like how does that all work?
Yeah, so a little bit going back to that nice network, when things are going smoothly, when we are resource regulated, we've got enough sleep, we're well hydrated, we're spending time with people that we love, doing things that we love, like that network is functioning nicely. But let's just say that you get, your inbox is full of emails, like you're behind on your bills, like there's relationship issues, whatever the stressor may be. Again, the nervous system being command central is going to send like, oh no, got to sound the alarms, like we're under duress. And so again, the immune system gets those signals, may trigger some inflammatory cytokines, and the skin is both a target and a source of the stress response. So it's receiving the signals from that top-down pathway. But again, the skin itself has its own HPA axis. So it also can create the stress hormones. Um, Stress hormones like cortisol in particular have a both direct and indirect effect on the skin. Directly, they stimulate our oil glands. So that pimple, that breakout, it is in large part because our stress hormone is directly triggering our sebaceous glands, our oil glands, to produce more oil. It is triggering inflammation to produce redness and, those painful cysts underneath the skin. It's also slowing down skin cell turnover. It's affecting the functionality of our skin barrier. So all the contributing factors of what drive acne are all being affected by those stress hormones and the downstream effects of what happens when those stress hormones are released.
And then I just wanted to get this really basic, but when you say nervous system is the command center, can you explain like what is the nervous system?
Yeah, so the nervous system, we think about our brain, our spinal cord, right, as like the central nervous system, but we also have the autonomic nervous system or the automatic functioning of things like how our heart beats and our breath. And so we also, I mean, if you think about, people think of like your brain, like your primary brain, your gut is like your second brain, your skin is like your external brain. And some people will say your immune system is like also has its own brain. So when we talk about like the nervous system, we're specifically speaking about like the brain structure and the spinal cord and the autonomic. When I'm talking about the stress response, it's really that autonomic nervous system, which is comprised of our sympathetic nervous system and our parasympathetic nervous system, which is really fascinating and a little bit more complex than we had once thought.
Yeah, and just to add to that, the central nervous system also communicates with our other the nervous system that you just brought up, and so the brain and the body are all connected. So it's
All
just all communicating. So I don't want people to think that the body, the gut are all separate from the brain, but it's absolutely connected. And in on your website, you have a free handout where you talk about the 5 stress triggers that can give a skin response. Can you mention the 5 triggers?
Yeah, so a lot of when we think about stress, we think about mental or emotional stress and things like that. From my perspective, skincare is all about relationship. It is the relationship between our mind and body, our relationship really as your most external visible organ. Your skin is impacted by everything it comes in contact with. Everything you think, feel, and do impacts your skin. So stressors can be the relationship that we have to ourselves, to others, to our environment, and to, our skin, again, is a reflection of how we move, how we eat. So it's really more of not a specific one thing, but more of really inviting people to consider how they're in relationship to different factors in their life, whether it's movement, whether it's other people, themselves, and such. So that's kind of what that's about. I don't want to get, I think it's really helpful when people, it's actually a quiz
Oh,
that
okay.
and discover for themselves what their stressors are. And it may surprise them because people think, oh, I'm just stressed, but like for you and how it presents, right? Because skincare isn't just what shows up on the skin, it's actually how we show up in the world, right? For many of us, our skin can be a source of shame and embarrassment, and
Right,
we may cover up and hide by no fault of our own, right? We live in a society that puts so much value on how we look,
right,
how big we are, how small we are. And so many of us have been made to feel like we have to hide and mask and camouflage. And so my invitation is to throw that narrative aside and to use what shows up on your skin or how you're showing up in it as an invitation to get really curious about what are the things that may have led to that, because we have the power to change. But it's only when we're aware of that we can.
okay, and I'll put that link that I saw that in the show notes then so that people can take that quiz. So I'm curious, let's say I do have stress and then I start breaking out. And so now I know that maybe there is more of a root cause and maybe I have to kind of dig into my life, my lifestyle, maybe the diet, all of those things. But instead there's like an easy cream that I can use to sort of mask and get rid of, the few day pimple and then it goes away thing. Are those the right tools to be using? I mean, can we use those and then maybe work on our lifestyle? I mean, what are your thoughts on some of the skincare routines that we're using? Are we making mistakes? Are we exacerbating some of our skin imbalances?
Yeah, that's a great question. And I think it's a both and. I struggle with people who are so dogmatic, like it's all about your gut. It's just what you're eating. It's move this way, lift heavy weights, use this product. That's exhausting. It's overwhelming. It's contributing to stress. I know for myself personally and from when I was practicing in more conventional clinical setting, right? And especially with the women I work with, when things show up on your skin and it does create stress and anxiety and shame and overwhelm, do what you need to do. So if there is like the if it makes you feel comfortable to cover up, to get out of your house, to get done what you need to do for the day, do it without shame, without guilt, without judgment. But know that a lot of the products, they are just a band-aid, right? They're just covering up. But if it creates the bandwidth and the space to be able to then do some of this deeper work, heck yeah, right? I have nothing against medication. What I do struggle with is that we stop there. Why are we using antibiotics? Well, there's some sort of imbalance in the skin microbiome or the gut microbiome that's contributing to this. Okay, great. Well, let's address that. Let's figure out what's driving that. And again, once you fix the gut, my question is always, well, why did the gut go out of balance in the first place? That's why I focus on that mind skin connection and nervous system regulation, because that's where it starts. And a lot of where this started didn't start now, right? I'm in my 50s. It didn't, my aches and pains and some of the long-term challenges that I had did not start now. They are deeply rooted in my lived experiences from a long time ago, back there, back then when my needs were not met. And I have made adaptations and molded myself and shape shifted myself to fit into a society. And the result of repressing my own needs, my own emotions, has manifested in, for some people, it is an external manifestation. For others, it's their thyroid. For others, it's their gut. For others, it's chronic aches and pains. So I will never say don't use the medication, but don't stop there because that is not going to keep the problem from coming back.
So just working with people, if I notice that if there's like an easy pill, then they don't want to do the more deeper work because so let's say I'm like, okay, I get it. I have skin issues because I have underlying trauma or something that I'm not taking care of. And then life gets busy. I take the pill, I take the medicine, and it's gone. My skin issues are gone for now. And then it's like, oh, I'll do that other hard work later. So could the band-aid become a detriment long term? Because most people will only change with divine intervention or abject misery. So if there's no abject misery because there's a new retinol cream or some type of hormone medication so that they don't have to do that hard work. In your practice, do you see that people will say, okay, I'll take the medication, but I will do the hard work? Hey guys, just a really quick interruption. If you notice, we don't really run ads on this YouTube channel. And just being fully candid, instead of making money on external sponsors, we really wanted to share more about our functional medicine practice so that if you ever need it, you know that what we offer and what we can provide in terms of service and products. If you didn't know, our private practice has one-on-one sessions. We have packages. We do group calls with SIRS and with mind body or nervous system regulation. And we also do a lot of functional tests. Some people do a complete wellness panel with us. So once a year, they get a detailed, comprehensive blood work to see how their health is doing. We also do functional tests such as stool tests to see if you have parasites or candida or H. pylori. We also do a lot of the Dutch urine as well as saliva tests to make sure that your hormones and thyroid is functioning well. Our flagship is our symptom burden, where we really trust the innate wisdom in our bodies. And so we are trying to see what symptoms do you have, because oftentimes a combination of symptoms is related to a specific system. We focus on gut health, where we try to get people's gut healing because most of our immune system is in our gut. If you make your own body stronger, you will be a lot more resilient to everything that is in our toxic world. We believe in wellness for all, and not everyone can afford to work with us. So we provide a lot of free guides, free ebooks, free downloads, free tactical things to get you healing in your wellness journey. We also write comprehensive, detailed articles. For example, why a carnivore diet may have lower T3 markers, but may be in fact okay. I hope that the content I share is enough for you to get healing. But if the needle is not moving enough with a carnivore diet, with lifestyle changes, with mind body work, if it's not moving enough when you are working alone, just know that we have the services to support you when and if that day comes. Because we are holistic health, we also have a prescriber. So if you are on thyroid medications or hormone medications, or you need medications for SIRS, we are able to walk you through the process. Our goal is to get you off most of your medications. All right, guys, thank you for being part of this community. Let's get back into the video.
So I'll name that I'm only seeing people, I'm not prescribing medication.
Okay.
So I'm seeing people who've been to the naturopath, who've been to the acupuncturist, who've been to the chiropractor, who've been to the dermatologist. They have therapists because they've been in talk therapy for so long.
Right.
The problem is still there, or it clears up, but it comes right back. And they just are exhausted. Those are the people, right? That pain, right? That's how I wound up here. It was so painful because I had, early melanoma, and then it was gut issues and hormone issues and surgeries. And I finally had to realize, all right, the pills aren't going to do it. The detox isn't going to do it. I can't exercise. I can't supplement. I actually have to face what's happening. Not everyone gets to that point, right? They're more than happy to just take the pill and it works. But I see the people who've tried all those things and they know deep inside, like, there's more here. And your skin really does express what the mind suppresses in many instances. And we can look at the literature to support it. For instance, chronic hives, right? Urticaria. It has been referred to as like an allergy to life in many ways. When those individuals, they did a study, many of those individuals struggled or were, struggled with emotional neglect. They weren't able to express what they needed. They were maybe told that's not important, or what are you crying about? Like, cut that out, all the things. They had to make themselves very small. And so their voice, they couldn't use it in the way that they felt they needed to. Their skin now in these hives, right? It's screaming, it's inflamed, it's saying, look at me. And I can tell you that when I've worked with clients and we've kind of uncovered, okay, what is the story? What is your unique story? Where did this come from? And being able to work with the body to many of us inhabit different shapes and postures based on that experience, right? Right. The kind of this is like I can't even help it. Like the curved in shoulders of like kind of a like a shame posture, right? And when we can become aware of that and help the body find new shapes that's safe in a slow, in it, right? We can't just like rip off and the band and be like, you're good. We have to work at the pace that our nervous system can accommodate, but the hives start to go away. Hair loss, right? This is another one. Stress is hugely involved in hair loss in many instances. And as we bring a little bit more regulation, as we kind of get to I wouldn't say there's never just usually one root cause. It's accumulation, right? That started in our young childhood when our caregivers may have tried to do the best that they could, but they didn't know what they didn't know either. They can't give what they didn't get, right? And so we had to adapt ourselves, make ourselves smaller, maybe suppress and not share or not show up in the way that we really wanted to, right? So it's a cumulative effect. The reason why we wind up in relationships that don't serve us very well, right? We tend towards familiar because it feels safe. But when we recognize these are the patterns, right? Our body shape can change. Our energy can change. Our skin reflects that. We feel more at home within ourselves. So it's really interesting that our skin really can be a storyteller from that perspective.
What's interesting is in our practice, we work with a lot of people that are chronically ill. And one symptom that they often have is mast cell activation or, the immune response, the first white blood cell defense is so maybe it's something they ate and now they're having a histamine response or some type of mast cell response, or they feel fatigue. And so they're like, I know for sure that I can't eat that certain food, or I have a certain allergy to something outside. And now that we have our own mind body program, we realize there's more to it. And actually, your brain is, there's a lot of mast cells even in your brain and so I'm curious, in your practice, have you seen people that have, beyond just the hives, but, any type of mast cell response through doing this nervous system work? Have you seen healing? Because I feel that the mast cell response seems to be some of the hardest stuff that we find that takes I guess is delayed in healing.
Yeah, yeah. So there's a lot, like, especially, I don't deal with like eosinophilic specific conditions, but even eczema or psoriasis where there's itch involved, and so a lot of that is a cycle and a pattern and a rewiring of how things are connected. And so by doing more of the mind body work, equipping with tools, and when we're talking about like nervous system regulation, it's not that we want people to just be calm and chill, right? We want people to be able to ride the waves of whatever is coming up for them, including anger, including sadness and grief, and be able to have the capacity to be with whatever is here. And as clients learn how to be without rejecting it, judging it, fighting it, thinking it shouldn't be this way, symptoms do start to improve. We are dynamic human beings, however. Does this mean that there's a cure? I really struggle with that one because things change,
Right.
right? Environments change. And so these conditions may flare again, but typically they don't flare for as long. They don't have as much of an impact on the individual because they're like, oh, I've been here before. I know how to deal with this, right? And support oneself. So I would say yes, it's never just one thing, but I think the mind body piece, and I would imagine that's probably why you added this to your comprehensive programming already, is because it's the piece that most people don't even think about want to deal with because it's hard stuff. And it's the one thing that we weren't taught to do, right? We know that we're supposed to eat good food, like healthy food, or we're supposed to move our bodies, and the more information and research about the importance of sleep, but managing our emotions, like what? No one taught us that. Certainly didn't teach us that in medical school.
So you think, just to clarify, because a lot of people, including myself, now I think I'm a little bit removed from this fully, but we think a lot of the skin health is a reflection of your gut health. And
Mhm.
so psoriasis, which is technically an autoimmune. So if you fix your gut by fixing your diet and even eczema, all of that will clear once you
Mhm.
change your diet. But you are saying that there's a component, especially if you've tried all that, like you've tried the gut health, you tried the diet, and you still are suffering with skin issues, specifically eczema and psoriasis, that the mind body connection can have a big component, the nervous system.
I do think so. I actually had someone come recently. Again, they were someone who had gone to the naturopath, the primary, the dermatologist, had been on parasite cleanses, detox cleanse, like every cleanse you can imagine, and they were exhausted and had spent a crap ton of money on all of this,
Right.
and they still had issues. Went to therapy, tried to get hypnotized, right? But it wasn't really working. As we began talking, it became very clear that lived experiences from their childhood of not feeling valued or seen by their father. There was anger. Psoriasis is one of those conditions, and it's well published that there is a comorbidity with depression.
Oh,
And depression and mental health issues, right? The question is it the chicken or the egg? There's actually, I think they're very intertwined. Gut health does play a big role in psoriasis, but one of the primary emotions tied to psoriasis is anger. And if you look at psoriatic skin, right? Yes, there's thick scales, but if you can remove those thick scales, like the skin is red and angry. We even talk about like it's inflamed, it's angry, right? But most people, they don't know how to deal with that anger because to let it out would have been punished or shunned or shamed. So it gets repressed. So I do think that our mind body connection, that mind skin connection, because the brain and the skin, they're derived from the same layer of embryologic tissue, that ectoderm. So they are in intimate communication. They're communicating with each other all the time. Like, I'm super excited to be here with you right now. My pits are a little sweaty. Like, I was a little nervous. Like, that is real time mind skin communication.
I can support in our practice. So most people are on elimination diets and work on gut healing, and we have a subset of our population that their eczema or their psoriasis, it doesn't fully get better. And so, like you said, the newest thing we've created in our practice is the mind body, because we realized that was the one thing we kept hearing is in our intake forms, we ask about trauma, and most people say, yeah, I've had some type of something, and most people don't want to deal with it. And so we realize it's a big part. And you could tell in the way they speak or the way they write stuff. You're like, oh, there's something there that you totally need to look at. And it's just harder to bring it up. But I'm right there with you. I think there is a strong component there. There's a big piece where people will say, oh, I have nice skin because my parents have nice skin. But how much do you think the skin health then is genetic?
Well, I think, especially if you have more pigment in your skin, right? You're not going to be as vulnerable to the damaging effects of ultraviolet radiation. So I think there are certain aspects that can be more genetic, but our lifestyle definitely plays a significant role. If you look at studies of twins, for instance, one who eats like a whole foods diet, uses some protection, gets sleep, has a sense of purpose, and all of the check all the boxes, and then their twin smokes, eats junk food, right? The differential between the tone, the texture, the turgor of the skin, the susceptibility to inflammation and rashes and skin cancer and such, it's going to be different, right? So I think genetics will always play a role, but I think our lifestyle and our lived experiences and how we um, can manage the stressors in our lives play a significant role because we know. Let's just talk about sleep for a second. Stress and sleep intimately connected, so intimately connected. Because if you think about the cortisol curve, like the relationship between cortisol and melatonin, right? We need cortisol, right? When we talk about stress hormones, stress isn't a bad thing. It's a normal biologic adaptation. We need stress. And in the acute setting, it can boost our immune function and it gets us through the hard stuff. The challenge is when we are dealing with chronic stress that leads to suppression and dysregulation of that nice network. Cortisol, we need it to rise in the morning and so we can get up out of bed and do what we need to do, and then it peaks and then it's supposed to come down at night so we can go to sleep as melatonin is increasing. Melatonin is one of the most potent antioxidants that our body can produce, and especially really important for skin health. Melatonin is really important for DNA repair. And a lot of that repair, rather that rebalancing of hydration and repair of DNA happens at night. But if we're constantly stressed, right, and our cortisol isn't following its normal curve, there's going to be that imbalance and that dysregulation. And so we might be wired and tired, we're not getting enough sleep, and our skin doesn't have ample time to repair itself, right? So this is why I think addressing stress is underrated because it impacts every aspect of our life. If you're not getting sleep, then you're going to be reaching for, caffeine or this is herbal tea, but but like we're going to be reaching for things to give us a jolt of energy, sugary food. We're, just kind of not moving our bodies. It's going to have a snowball effect, and that is going to be reflected in the turgor, the tone, the texture of our skin as well. So,
So I can see that with adult onset acne, then maybe that kind of answers some of my thoughts in that of why do some people all of a sudden start getting adult acne when they didn't have it when they're younger. So maybe it's sleep deprivation, lifestyle, mind body stuff, and then extra stress in their real life. In adolescence, you see certain kids or certain teenagers get a lot of acne, and then certain kids don't. Is that mind body related? Is it mostly hormones? Why is it that certain people?
yeah, that's a great question. And it's never just one thing. There are some families like, there is a vulnerability for acne. But if you think about skin health being the intersection of metabolic health and mental health, right? So as teenagers, right, there's hormonal fluctuations. Most teenagers are not necessarily eating the most plentiful, abundant, nutrient dense foods. So there are potential for inflammatory triggers. Dairy, for instance, chocolate keeps coming in and out of like, does it mess with, does it cause acne or not? But we know that dairy for some people does increase, insulin growth factor 1, and that directly stimulates your oil glands, can make, the cells a little bit stickier. So like food can make a difference. And teenagers, right? A lot of teenagers, they're just, especially if they're in sports and they're told that like drink chocolate milk, so it's like sugar and dairy, and like, there's a lot of different factors. And then there can be relative imbalances of the hormones so that some can be a little bit more androgen dominant. And that can also contribute to acne and PCOS and yeah.
And so then before we move into tools for nervous system and then how to get, to that root cause,
Yeah.
just from a skincare, what are some tips that we can use for our skin? I mean, are you opposed to certain products? Do you like certain products more?
Yeah, I can tell you. I have a closet full. I mean, I use all the things, but I don't usually poo-poo any particular
Okay.
brands or products. I don't think you really need a toner, to be
Okay.
honest. I don't. I maybe I'm lazy. I don't know. I like to keep things simple.
I'm the same,
Keep
but
it
go ahead.
simple. Like I think it creates a lot of stress. Social media is one of those like really you can learn some things, but it can also be a source of stress,
Totally.
right? One of my biggest skincare tips is be very mindful of what you consume, right? Trauma is an environmental issue, right? It's the environment in which we are placed. Is it conducive to supporting having our needs met? Skin health is also an environmental issue, right? Ambient, like it's UV exposure, air pollution, it's ambient temperature, and it's also what you're surrounding yourself with, what you consume, right? If you're scrolling through things and they're bringing joy, great, keep that account. If it's creating a felt sense of contraction or a felt sense of shame and anxiety, you're activating that stress response. And we already know there's this communication between all your systems, and it's just inviting the potential for triggering or flaring whatever condition that you're dealing with and or something new. Yeah. So that is a skincare tip that I don't typically think about, but what you consume on a daily basis on social media is really important, including thinking that you need to go to, Sephora as a teenager and buy all this expensive stuff. You don't. You need a gentle cleanser, an antioxidant serum, ideally with vitamin C and E as a bare minimum. There's a lot of other ingredients that you can add, but the research shows that the synergistic effect between vitamin C and E are really potent and powerful. And then a sunscreen, SPF 30 or above. I like a tinted moisturizer because I use it kind of as like foundation slash protection. Evening, repeat, wash off the day's grime and your sunscreen, antioxidant serum, and to increase skin cell turnover and help your body rejuvenate and collagen production, a topical product like a topical retinoid. Retinoid, retinaldehyde, obviously a prescription strength retinoid is going to give you the most bang for your buck, but not everyone can tolerate it. So something like bakuchiol is an alternative to that. And head-to-head studies have shown that it has similar efficacy. So basically you need 3 products, 4 products. That's it.
In terms of sunblock, so a long time ago, when I first got into the wellness space, I wrote an article about how sunblock has some, chemicals and ingredients that are less than ideal for the skin, and that some of them actually can cause more of the skin cancer. And so we were on a stint, my family, where we went to Mexico. And so none of us used sunblock. And my husband and my 2 boys got sunburn. And they're like, next time, let's not listen to mom. And so now we will occasionally use mineral sunscreen. Do you have a preference? Because I know, it's not ideal to also get sunburn. So if you're going to be in the sun for that long, maybe you do need some type of sunscreen to protect your skin. And so now we will stick with like the zinc oxide or the mineral sunscreens. And I know they kind of wipe off and there's cons to it too. But overall, I just was wondering your thoughts.
Yeah, yeah, absolutely. First of all, skin cancer is the most prevalent cancer in the United States and Canada, as well as some other countries around the world. Most people don't may not know that or may not appreciate that because it's not as in the news as breast cancer, right? Because it's more easily dealt with. Because we can see it, we can treat it. But skin cancer is the most prevalent cancer. 1 in 5 people will develop skin cancer in their lifetime. So sun protection is really, really important. And if I can't appeal to your concern about skin cancer, let me appeal to your vanity because upwards of like 90% visible signs of aging are because of UV exposure. So you want to protect your skin. This is not to say don't go outside and benefit from getting sunlight to help regulate our circadian rhythm, to get the benefits of the feel-good benefits of being out in the sunshine. It just means be smart, right? If the UV index is way high, maybe don't go out then. Go out earlier in the morning or later in the day. And in terms of sunscreen, I'm all with you on the mineral sunscreen, mostly because it's tolerated by most people. It is really non-sensitizing. We use zinc oxide in diaper cream, right? We're using it on our baby's bottom. And so that's what I love about zinc oxide because you can use it from the little littles to any age and on without significant worry about irritation or inflammation. The the quote unquote what we call chemicals, those are like called considered physical sun blockers, mineral zinc oxide and titanium dioxide. The chemical sunblock, well, they're all chemicals, but the chemical sunscreens like avobenzone, oxybenzone, octinoxate, avobenzone in particular is one of the leading causes of irritant contact dermatitis. That's why our family years ago stopped using it because we all broke out in a rash.
Interesting. Okay.
And if you look at the FDA, they have something called generally recognized as safe and effective. Zinc oxide and titanium oxide are listed among those two.
Okay.
And they offer UVA and UVB protection. Now, there are some really good chemical sunscreens that are more stable, that offer really broad spectrum, but in terms of safety profile and all of that, you know, that's always controversial. But I would say zinc oxide, you can't lose with it. Yes, it's not as elegant. There are some formulations that they're making that make clear zinc oxide, but I would say limit it to just the exposed parts. I'm a big fan of the big hat, the sun protective clothing, right? Like, how do you know that you're a dermatologist kid without knowing they're a dermatologist kid? Because they're the only ones on the beach. It's like the shirt, but they've made some cuter stuff now. So I would say if you're really opposed to wearing um, chemicals on your body, and I don't blame you, I don't really like it either. I choose to cover my body because clothing is really the number one protection you can get.
While you're talking about the clothing, so if our skin has our the own HPA access, and maybe there is no answer to this, but it just makes me think: is it worse to touch things that have like BPA, or we use antibacterial, which is low doses of antibiotics, or or we wear clothes that are not 100% cotton, so like if there's plastics and we hear about the fears of microplastics, or then we use chemicals on our skin, whether it's like the shampoos or our skincare. Is there one that's worse than the other? Like if as a, dermatologist?
That's a tough one, right? Because it's a cumulative effect. If you think
Okay.
of like our toxic load, right? Like this mason jar. Well, you've got your hair dye and you've got your shampoos and your makeup and then your sunscreen and then your clothes and then your plastic water bottle and then the chemicals in your food and the dyes and all of a sudden this thing is spilling over, right? So not to make it so overwhelming, but like if you have a favorite, I always think of it this way, like if I'm going to color my hair, what else can I do to maybe offset that, right? Use the sun a little bit more or like choose other things that perhaps can decrease my toxic load, right? We have to live. We can't live in fear, but
No,
I
totally.
do think that it's a cumulative effect. And also like some of us, right, if we've got our SNPs and I'm not the genetic guru here, but I do know that some of us aren't as able to metabolize and process things. And so we're going to need a little extra support as well as being mindful of the things that we bring into our world. So if we can minimize it on all sides, great.
No, I totally agree. So that's sort of the methodology I use. So obviously, when I'm filming, I'll put on makeup, but then all the other days, because maybe I'm sure my makeup isn't perfect in terms of quality and safety. So then all the other days, I just try not to wear makeup. So to circumvent that I'm having makeup on right now, for example. And one thing that I saw, and the reason we created the Mind Body is so we focus heavily on the environment, and so people with mold illness, we started to see, okay, good, like we're educating people on mold, and then all of a sudden it pivoted so quickly to I can't go anywhere with any mold, and now their nervous system is so dysregulated because they're fearful of any bit of mold anywhere, and so now we have to reel them back. So I agree with you. I think pick and choose where you can support your skin, but you're never going to get it perfect, and that level of perfection is also going to impact your nervous system anyway. So I'm right there with you. I just thought maybe there was one that you dislike more, but that's so interesting. One more. Go ahead.
I would just say, pick the one that's most important to you. I don't know. I mean, our clothes were always, I mean, ideally, But yeah,
No, I totally get it. I'm there right there with you. Is there skin differences with males and females, like skincare that we need to do? Because you go to the skincare aisle and now there's men lotions and female lotions. Does it even matter?
yeah. So when from a perspective of like science, right? So when they've done the research, men have more oil glands, like they're more oily, so they may not get as dry. So
Okay.
there's going to be things creating products that really don't add a lot of excess oil, but also women may need a little bit more hydration. And also, I think a lot of it is some of it is marketing. I'm not gonna, but also in terms of thickness in certain areas of the skin, there are gender differences. But I think a lot of it, especially from the cosmetic world, people saw an opportunity. I mean, let's be real, they saw an opportunity to really capitalize on a market because men feel I mean, we always think it's women that feel the pressure of how they look and how small or how big or all the things. Men actually experience it. They may not talk about it,
Right.
but they're experiencing a lot of body image challenges as well. I'll never forget. This is why I talk about like pay attention to what's in your social media feed. My son, who's now in college, but when he was 14, like just kind of coming into his teenage years and his body was changing and happy-go-lucky kid, very athletic, but he came into my office and he was like just really glum and down. I was like, dude, what's going on? It's like nothing, nothing. I was like, no, seriously, what's going on? And he said, I don't know, like I just feel really small and scrawny. And I was like, dude, where is this coming from? And he said that he was getting on his Instagram feed all of these like videos and advertisements for like six-pack abs and all this stuff, like just targeting him. And it just, right? Like we don't think about it, but there's pressure on all sides of the equation. And so I do think that a lot of the products that have come online are partially marketing and partially feeding into that insecurity that is generated by this society that we live in.
No, that makes full sense. I've never really covered it, but I know that the age of where men or males are starting to use steroid use to just get bigger, it's getting younger and younger. It's why one of the reasons I try not to have my kids, and my kids are a lot younger. The oldest is 10, but I fear the day that they get on social media because you can't help as a community, we want to belong. And when you start getting fed all these the same message that everyone your age needs to look like this, that scares me because as humans we want to belong, and so we feel like then we must look like that, and if we don't look like that, then what product, what thing do I need to take? And 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 my male cousin, I know deep down that in high school he suffered from an eating disorder, but it's not as openly talked about, so I completely understand.
Yeah, I mean, a few years ago or was it last year? I don't know. I've lost track of time. But all the media about these teenagers, and I did some press on it too about like all these tweens going to Sephora and spending hundreds and hundreds of dollars on beauty products, completely unnecessary because of what they were seeing on social media. And the parents just kind of let it happen because they're like, well, right, I don't want my kid not to belong. And they don't also know, like, is it necessary? I don't know, but I want to support my child. I love my child. I want them to be happy. So it's not their fault either, but it's like, all right, we need to get a grip. We do. We need to change the narrative. That's why I love that you have a mind body program. It's why I really want to change the narrative of what skincare actually is. It
So
is not what you put on your skin. Sorry, I just can ramble on.
no, no, I love it. So in your practice, then how do you start supporting skin other than, hydration and nutrition, sleep, and all of those things that we just talked about? So from a mind body perspective, I always have that hard time connecting that, like, so if I went into your office as a patient and yes, none of the other stuff has worked for me yet, but I don't know how you telling me that I have stress in my body is going to clear my skin. But how would you start I don't know if the word convincing is the right word, but how do you start treating me to start, working on the nervous systems to ultimately support my skin health?
Yeah, that's a great question. And this idea of convince, that is not what I'm here to do.
I know.
I I can't convince anyone of anything. So
Agreed.
if they're showing up, and my practice is predominantly virtual. I have a local center, but that I see people, but they're coming to me because they're anxious, they're overwhelmed. There are two types of people who come. One, that they've tried everything and their skin isn't improving. And during our conversation, they know that I'm not going to be prescribing medication, but what we're doing, once they understand how their body works and why it makes so much sense, and trusting that intuition that they had, that they know that there's something more, versus the second person who may not have a visible skin issue, but they feel so uncomfortable in their skin. They are feeling so frustrated, exhausted, stressed, and they've done everything. They've been in therapy, like nothing is working, and they show up to my office, right? So it's really helping people understand that they make sense, that everything that they're experiencing makes perfect sense. And I think that in many ways gives people a sigh of relief. You mean I'm not broken? No, you're not broken. You're not broken. Working with me, is that all you're going to need? Probably not, because I'm not a one-stop shop like you, right? Of having like the nutrition. I educate a lot, and as part of my group programs and my one-on-one, we talk about these things. But most of the time, they're coming because it's a felt sense of in their skin, they want to feel freedom. They want to know what it's like to be able to walk out of their house not having to cover up. So we work from that lens of empowerment, of finding their edges, of helping them understand that they're not broken at all. They just had to adapt to environments that weren't conducive for them to be able to be their full selves. So it's not for everybody, but I'll tell you that it surprises people how much they didn't know they needed this type of work.
Absolutely. I mean, we see that in our Mind Body program as well, where people will say, I didn't realize that this was connected or that I had trauma in my childhood. I thought it was pretty normal. If you can give me a example of maybe a client that comes in and some of the work you do. So like what's a tangible, maybe a tool you teach them or you walk through so that it's like, okay, I can see how you start working with individuals.
Yeah, yeah. So one in particular, one of my favorite clients, she actually is a melanoma survivor, and had a lot of anxiety. It was, I guess you would say, medical trauma from all the poking and the prodding and the procedures and all of that. As we got to know each other and kind of peeled away the layer, right, exfoliate the layers, right, it became very clear that there was a lot of childhood trauma as well. So when someone comes to work with me, it has to be very slow. This is not a quick fix, right? This is not a quick pill. But some of the techniques, breath work is a beautiful technique, right? Because it all comes back to vagus nerve, vagus toning, neural exercises. And so we know that the breath is the quickest way to activate that vagus nerve, because the phrenic nerve is coming down and activates the diaphragm, and the vagus nerve is affecting our face, our throat, our heart, our gut. And so breathwork techniques can be really powerful, potent. And the beautiful thing is, because people worry, am I going to have to sit and meditate? Like, I'm so bad at it. I tried it. It doesn't work. Like, you don't have to do any of that. You're breathing already. And so there's umpteen number of different breathwork techniques that I can teach somebody that they can do anytime, anywhere. In fact, this client that I have is undergoing treatment. And she was like, well, what do I do in the waiting room? I get really anxious in the waiting room. I can't do, because I do a lot of movement with people as well. She's like, I can't just stand up and move. I was like, well, you could, but I understand self-consciousness, whatever. But I was like, all right, but you can do some eye movement. There's some eye movement exercises, self-touch, right? Right. The butterfly hug is really good, or bilateral stimulation, cross-body movement, and breathwork techniques. So unlimited. number, but we have to go at a pace and we have to do, I always think of it like a buffet. I'm going to make a lot of invitations. You are going to choose what actually works. We're going to try them on, go to the buffet, you fill up your plate, you try some things. If you don't like it, you don't have to keep eating it. You don't have to go back for seconds.
Can you share a remarkable healing story, specifically about, doing this nervous system work and then maybe the skin healing?
Yeah. So, a client with hair loss, actually. So, hair loss is another condition that really a lot of people struggle with
Right.
shame and right because a good hair day, right? We make so much of our hair. There's a whole industry of hair extensions and such. So, this woman would spend hours trying to camouflage and cover up and just trying to get out of her house. And by the time, after 2 hours of just trying to figure out, can I do it? She'd say, F it, like, I'm not even going, right? So, and it was interfering with work, it was interfering with her relationships. So, we started working together. And of course, we're focusing on some lifestyle factors as well, right? Because we need to support the body's capacity to handle stress with sleep and good nourishment and doing things that actually bring joy and pleasure. I think too often when we're in the healing process, we focus on what's wrong versus turning our attention to things that are actually going so right. In fact, that the hair is falling out in many ways, something going really right, right? It's the body is showing you that it needs support. So as we were going through the process and teaching her some tools, she noticed number one, her mood was improved. She had more confidence. She got out of her house. And even though she had a scarring type of alopecia, so there's areas where the hair won't grow back, the hair loss slowed down, right? So none of this is like, I'm not going to BS you and be like, this is the magic cure. People were cured for, I'm like, but it makes a significant impact. It can make a significant impact on the quality of someone's life to change the relationship they have with themselves and to their skin issue that has been keeping them from living their life. It's significant. But I love that particular experience because it really was dramatic.
Yeah, I love it. We hear the saying so much like, "Oh, I don't feel comfortable in my skin," and I never realized the depth of what that means. And I love it that you're sharing this work because so much of at least the wellness space I'm in, especially since I started with nutrition and diet, everyone thinks that everything can be fixed by diet, and being in the space long enough where you have canaries in the coal mine that are like, no, it actually doesn't fully work, and I'm not cheating on my diet, and I'm following everything you say to the letter, and I'm still not better. And then you start uncovering other areas. And I think this whole nervous system regulation, I mean, what you say about what we let into our eyes and then our minds, and it impacts our heart. And I think the more that we focus and think of negative things, because we're more kind of wired to protect ourselves, and so we want to know all the negative things, it's our world starts becoming covered with negativity. And so then we have like a part of our system, our reticular activating system, that just focuses on, okay, you believe that there's this negative, then I'm going to just focus and help you find that negative. And it's just, I could see that. I could see your son, seeing on Instagram all these like really, buff people. And then probably that's all he'll notice going out to the gym or going to the basketball court. And then it'll just further his belief that he's different. And so I see that. And I just love what you're doing because I think skin health, yes, it can be a reflection of your gut, but there are people even in our practice where it does not heal fully with just diet alone. And I think this is an area that people aren't considering as much. And I love that you're doing this work. Where can people find you? So do you do one-on-one groups? If you could share a little bit more about your practice, if people, are frustrated with their skin health and maybe there is something more underlying.
Absolutely. So I do both. I do work one-on-one with people, and I have a 12-week group program. I haven't yet put out the date for that, but what I love about group is the sense of community and connection for people to not feel like they're alone. And the one-on-one is really special because we can fine tune to exactly what's happening with someone moment to moment, right? I think you said something about the skin is, not just a reflection of what we eat or the gut. And I also really want to emphasize that your skin is not a reflection of your worthiness. It's not a reflection of all that you are, right? Your skin is maybe needing a little extra support. It's offering an invitation of where you may need to focus some attention, but it doesn't take away from your value, your worthiness, and what you can offer to the world. And I think our social media, our society at large has done all of us a disservice by putting so much emphasis on our appearance as a metric of our success or, our value in the world.
Oh, thank you. I was going to ask you, like, for anyone that's suffering with skin issues, if you have a message, and I think that really sums it up well. I personally never struggled with acne, but my brother did. So I know that he struggled because I would see him look at in the mirror all day long in his high school years, and then he would use every single cream because the goal was to get clear skin. And I never walked that path, so I never understood it. But then I struggle with an eating disorder, and all of a sudden I'm dealing with like dermatitis and bits of eczema. And so I started understanding. So then I would just cover my skin up so that no one could see the struggles I had. So I can see how if your face or some part of your body is not good enough, you could just associate that I'm not good enough, so I shouldn't show my face to the world. And there's actually a group of people with autoimmune specifically that believe that if you're not good at having boundaries or having your own self-care, that your body will create its own autoimmune. And I wonder if people have had any childhood trauma with somebody being too close to them, even physically, maybe emotional abuse, then if you can manifest stuff on your body, skin issues, then it's like, hey, now you don't want to touch me, right? And I just wonder, it's just so
Yeah.
fascinating as you're talking about this. Yeah.
But this could be a whole nother episode, but yes. In fact, one of and Dr. Gabor Mate in his book The Myth of Normal, as well as The Body Says No, highlights a really great example. And I've had similar as well. This condition, scleroderma, where the body actually sclerosis is a hardening of the skin. It's what we like, almost like a mummification. The skin hardens, the vessels harden. Like it's devastating. It's a devastating condition. If you think about it, the body has created a coat of armor, like literally
Right.
by constriction, and you like, I can't move. I don't know if I tried to get this published in our major journal, and they rejected it, which doesn't surprise me. But many of the individuals who have experienced this condition, they have a history of sexual abuse, of physical abuse.
Wow.
And it was a way of protection, a way of protection. There are so many examples. I'm giving I gave a grand rounds, but it's a talk that and we're hopefully getting a paper published about this, of childhood trauma and skin issues. Eczema, psoriasis, urticaria, skin cancer, all types of skin cancer, basal cell, squamous cell, melanoma, alopecia. I think every condition can have a root in trauma. And I think, when I started this work in trauma, diving deep, I was like, I don't have trauma. What are you talking about? I'm at home on roof. I had loving parents, right? But complex PTSD over here, because it wasn't the big things.
Mm-hmm.
It was the little things. It was my caregivers not being attuned to who I was, wanting me to be different because I didn't fit into what they thought I should be, because kids were supposed to be seen and not heard.
Right.
The kid wasn't supposed to walk on their toes. They were supposed to, have a very elegant, like all the thing, all that stacks up. So many of us, I don't think there's probably any one of us that has not experienced some adverse event in our lives that may have not registered, right, if we were resourced enough. So when we talk about the difference between stress and trauma, stress is a normal biologic adaptation. We are wired to deal with stress. There's different types of stress. There's good stress, like going on your vacation or getting married, right? Versus the distress of things that we don't want to happen, things that are really challenging. Trauma is the inability to adapt to those stressors. right? It's outside of our capacity. And in the short term, we might deal with it. We're wired to deal with it by, you know, going into our survival coping strategies like fight or flight. And when that isn't effective, when we can't get away, when no one's coming to help us, we go into shutdown. We go into that freeze mode because the whole point of our existence, how we are wired, is for survival. And so if people are stuck and frozen, they felt like they couldn't move, they couldn't get away, they don't know why they can't get out of bed. We talk about functional freeze all the time. You're scrolling, scrolling, scrolling. Yeah, you're in the shower, you don't want to get out, or you're in your bed, you just can't get in the shower. Like so many of us are stuck in that. Nothing really has gone wrong, right? That is the trauma response where those survival coping strategies became almost conditioned, right? And they've outlived their usefulness. And it's only when we become aware of it that we can find ways to support ourselves out of it. And we have to go really slow. We have to be very compassionate and gentle with ourselves because it wasn't our fault that we wound up with these responses. We had to adapt. We had to survive. But now that we're adults, we have an opportunity to change. We do have a responsibility, right, to take control of our health.
I love that because you can also then, for me personally, working on a lot of that stuff with my own story was I didn't want to pass down generational trauma. So if I can't stand for myself, I will do all the hard work because I don't want my children to suffer from whatever I suffered from. I don't want to pass down my traumas to them. And so that became a essence of me of wanting to do the work. So I will heal myself because because I want to be a better mom. And that was a bigger why for me. And it worked because now I know the areas that I need to work on and still support and heal. And I love everything you brought up because I do think obesity is another example of how somebody that had some type of childhood event by making themselves maybe overeat without knowing it. If they're not thin enough or, good enough, then maybe no one will ever touch them again. So that's a lot more common one that I'm sure people that are listening and watching this can relate to. And it's hard because we are told, like you said, on social media that this is the reason we're sick, or this is it, or take this one pill and or this one protocol, and then everything will be healed. And we want it to be easy, but oftentimes it's a lot of the things we talked about, but the mind body work is not talked about enough. And I think when people, like you said, are at the point where they're sick and tired of being sick and tired, this is a area that it's finally, time to look under the hood and start saying, you know what, like, I don't want to be sick anymore. I'm an adult now, or I don't want to pass this on to my children or my loved ones. And I can live a better life. And I know I can, because for me personally, I was in the depths of suicide and I don't suffer with depression at all. And it was because I did that hard work. And like you said, it took time and it took years of me being kind to myself and figuring things out. But now looking back, I don't regret a single day of anything that has ever happened in my life because it has brought me here and healing and serving. And I think for you, I'm sure your story too, that's why you're able to serve in the way you do too. So thank you. Where can people find you? If you can share any, ironically, your social media or your websites,
Yeah.
where can people find you? And if you publish studies, like where can people look up stuff too?
Yeah, so I mean, I've published other studies, but it's all derm path stuff, so not as relevant. This is like, we're hoping it'll get published. So I'll keep you posted
Okay.
with
Okay. Yeah. Yeah.
childhood trauma and skin issues. There's so much there too. Oh my gosh. Um, I'll just say one thing.
Yes,
Kudos to you
please.
for doing the work because, especially with eczema, that co-dysregulation, kids sense, even if they don't say a word, they sense when the caregivers are stressed. So if your child is struggling with eczema, I'm not pointing the finger to blame you. I'm saying take care of yourself as the caregiver because you taking care of yourself, it has a ripple effect and it will affect the child and their nervous system and their skin. I can't even tell you how many parents, when they deal with their own stress, oh, they're like, oh, my kids are getting better. Their flares aren't as often or as bad. Okay, so just
That's
thank
so
you.
fascinating.
And also in the womb, the studies in the womb of the maternal cortisol affecting the fetus. Oh my gosh, and eczema. So it's all interconnected.
Yeah. And what's fascinating, so I could just, I'm sure we could go on, but So my kids are young, but they say that whenever parents fight, the kid always thinks that they're the center of the universe, and that's why their parents divorced or anything. But my kids, whenever and my husband and I barely fight, but if we do, one of my kids was like, "What happened? Tell me." And it's like, that's not your role. So I just said, "Don't worry about us. We will. You be a child." But it was very quick for my oldest child to want to play parent role, and he actually struggled with eczema, and I was still sick when I first had him, and he does not struggle with eczema. But for some reason I thought it was solely the probiotics, but I know we are a lot healthier mentally and physically too. So I wonder if that had a component in him not struggling with. That's so fascinating.
The skin, and this is why I love the skin, right? So many layers in the skin. Your skin has multiple layers of the epidermis, the dermis, and then beneath, as do we, as do our life stories, as do all the conditions. There's many layers that contribute. But to answer your question, so I'll keep you posted if the article gets published. But yeah, on social media at Dr. Keira Barr. I'm trying to be a little bit more consistent. There's a lot of, I feel like half information. I think there's a lot more now on trauma and somatics and nervous system regulation, but not always connecting the dots with skin. People talk about like the cortisol face and the hump and like from a place of fear mongering in some ways versus, yeah, this can happen and it's let it be empowering, not like you're doing something wrong. So social media and then my website, drkirabar.com.
Okay. And I think the reason why, and this is my assumption, but they showed studies that fear mongering actually does better in terms of social media eyeballs. And so that's why
I'm
people,
a
it's
failure in social media.
horrible. It's horrible. I totally agree. But to fear monger and to gossip and to just have negativity, that will enrage people, provoke people, and then they are more inclined to share. And that's what makes things go viral. Or it's just so different than what you would expect. And so that will then be shared too. So it's just unfortunate. It's part of the nature of social media. It's honestly why I've taken a step back, because it was hard for me to marry my understanding of mind body and then all the things I'm learning and then still try to play that algorithm. So even if I grow slower, I mean I have faith, so I trust that. And yeah, it's but it's unfortunate, but it's just, but us sharing this message is so important for people to really start healing. And as you said, one power we see in our groups is the connection. People finally saying, I see you, I feel you, I hear you. And your story is not any different from mine, even though we never see stories like this on social media. And that itself brings connection to people that would have never felt connected and have similar stories and similar wounds. And I think that itself brings human connection, and that allows people to heal itself too. So I think it's so powerful.
I had run a group specifically for a condition, hidradenitis suppurativa. This is a condition that it's almost like an invisible illness because for the most part, it can be hidden under clothing, but it's very painful and cause a lot of shame. There were a few women in that group who had never talked about their condition with anybody. And I'll name that at the very beginning, I want people to feel safe and I don't require that cameras are on. I just am happy that you're here and you're showing up. So at the very beginning, there were a few women, cameras off, didn't say a word. By the end of the program, cameras on, they're the first one. Aww. They felt so seen and safe and held and heard. And it was the first time in their lives that they could actually talk about it. So I agree with you. I think there is power in healing and just having, even for some people, they don't want to be in a group. And that one-on-one is also so powerful because we're holding space for someone, right? To be seen and heard and valued exactly as they are.
I love it. Thank you so much for the work you do. And when you release studies, please share and I will share, because I don't think there's enough information on skin health and especially connected to the nervous system. So I think it's so powerful, all the work you're doing. I will put all your links and information in the show notes, but thank you so much again for joining me today.
Oh, it's my pleasure. Oh, I forgot my book. That's something that can be a good resource too.
Okay, wait. Yeah, let's bring it up. So what's your, what book do you have? I'm sorry.
Yeah, it's called The Skin Whisperer. I totally forgot. It's called The Skin Whisperer. And it was really based on my journey of how it got all started because my It's really a journey of what to look for with skin cancer prevention from a whole body perspective. And it's called the skin whisper because I want people to be able to interpret the messages that their skin and their body are sending when they're just a whisper versus having to shout when things are too far down the road. So yeah, there's that.
I'm curious when you, because you are so knowledgeable about skin health, when you see someone, can you kind of tell what their health is based on looking at their skin?
Oh yeah, so you
Okay,
can,
that's what I thought.
especially metabolic issues, PCOS, if you see someone with a whitening part or, thick and dark skin, or there's certain, or even psoriasis, right? You're like, oh, your gut health might be a little bit off, but we know that there's something deeper. But yeah, that's what I love about skin. Within 30 seconds, people are like, my dermatologist isn't spending time with me. Yes, it's because they have spent probably decades that visual pattern recognition. They know what it is. Do they always know the best, like from a conventional standpoint of how to address it? Yeah, but we know there's so much more we can do that may take more time. But yes, you can tell a lot about how someone is experiencing their days just by looking at what's showing up on their skin.
That's fascinating. Okay, I will talk to you a lot more offline,
Okay.
but thank you so much again for joining me. I love it. I love it. Okay, guys, I hope you enjoyed the conversation. If you guys are like me, I was pretty surprised by the connection of children's eczema and how the parental role or the caretaker role can do and have an influence even without using words. I find it so fascinating that our nervous system can really impact even our own health. The way that we view the world, the way that we see the world is absolutely going to affect our health. And the things that we worry about, the things that we are concerned about, the fears that we have become the way that we lead our lives. If we're always worried that when we go out, that something bad is going to happen, what are the chances of something bad happening? As I mentioned in this interview, there is a part of our brain called the reticular activating system. And all it does is it looks for the thing that you are thinking about. So if you imagine that you bought a white car or you're trying to buy a white car, you'll probably see that white car all over the freeway and when you're driving. And in the same vein, if you're looking at something negative or you're thinking about something negative or something that might happen that is negative, you can see how the brain will work towards making that true. There is a study that shows that whether you are listening to music or a symphony in front of you or an orchestra, and then you're imagining it without the music even playing, the same parts of your brain light up. So you can imagine that when we are viewing the world in a negative way, that I will never get better, that I am not good enough, that I will never do the things or feel the way that I'm supposed to live my best life, then those things are likely to come true because you are manifesting it and believing these false narratives. When I was really sick, I thought I could never get better. And I really believed that. I thought I was one of the people that were doomed in this life that would always have an addiction or an eating disorder and always struggle with depression. And unlike other people, I would never be better. And until I worked on my diet, I leaned on my faith and I worked on the mind body stuff, I realized that that belief was completely false. And if you're faith based, it is lies that your enemy feeds you. I hope you consider some of these things if you are struggling with skin health. And if people in your family or loved ones are struggling with eczema or psoriasis, which is a very common illness, these are things to think about beyond diet and lifestyle and sleep. Okay, guys, make sure to eat a lot of meat, take care of your bodies and your skin because it's the only place you have to live. I will talk to you later. Bye, guys.